This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Old age, joint pain, wrinkled skin, gray hair, and cataracts. Did you know surgery to remove cataracts dates back to the 1700s? Now, back then, there was like a 50-50 chance of being successful, which meant you didn't go blind. But today, the surgery not only removes the cataracts, but it leaves you seeing better than you did 30 years ago. Somebody who sees that on a daily basis is Dr. Jason Yonker with the Chesapeake Eye Center in Berlin.
You might have noticed them when you were golfing, maybe while you were out fishing. Most first see them when they're driving at night, but chances are, if you live long enough, you will experience symptoms of cataracts.
So when a patient has a cataract, there can be different complaints depending on the type of cataract they have.
Dr. Jason Yonker of Chesapeake Eye Center says cataracts are a sure sign of aging.
If you open up an eyeball and look inside the eyeball, there's a little grape structure inside the eye. And it's got a skin surrounding, essentially a skin surrounding the pulp. And as we get older, the pulp inside turns cloudy, and then we call it a cataract.
He says it's a process that begins when we're born. Cataract surgery is usually necessary around the age of 70. The most common type of cataract is called a nuclear cataract.
So that one is the real slow-growing kind. Your vision kind of slowly degrades over time. You need more light to read on the page. You may think things may look dimmer. You may need more light in the room when you're doing different tasks and activities.
Cortical cataracts cause cloudiness to develop on the outer edges of the lens.
And that's the one that's going to give you more glare off of headlights at night. There's also a kind called posterior subcapsular, which is a little bit of cataract, but it's on the back of the lens, which is the important part because that's where all the light rays focus to.
When developing a posterior subcapsular cataract, a person may begin to notice a glare or halo effect around light and may also notice difficulty when reading.
And that one's going to give you a lot of glare and a lot of problems reading, especially when your pupil constricts when you read, so that comes into focus. So depending on the type of cataract, it's usually needing more light to read, glare off of headlights or street lights at night, or an overall blurring or losing the bottom of the TV or the little words on the bottom of the TV.
Dr. Yonker says there's no way to prevent cataracts, but you can slow the progression.
So let's say, for example, you're a diabetic. So if your sugars are running out of control, you're going to get a cataract at a faster rate. So controlling your diabetes is one way to slow down cataract formation. UV light's another way. So if we're out in sunlight a lot, if you're out without your sunglasses, you're going to produce a cataract at a faster rate as well. So certain things like that can produce cataract formation at a faster rate.
Dr. Yonker says smoking has been shown to speed up cataract formation. The good news is cataracts are easy to treat with surgery. Remember the cloudy pulp around the grape? Dr. Yonker says it can be removed and replaced with a new lens implant.
And then taking that a step forward, anytime you remove a cataract, you're taking the old lens material out, you have to replace it with a new lens material. So we custom order the lens implant for each patient, and we can then strive to customize that to try to reduce the patient's dependency on glasses at the same time as we do the cataract surgery.
A successful cataract surgery depends on timing, too.
I tell patients, if it ain't broke, don't fix it. So if you've got a cataract, and just because you have a cataract doesn't mean we operate on your cataract. There's been a lot of patients will say things, they'll come in and say, well, my doctor said it wasn't ripe enough yet.
Dr. Yonker says if you wait too long to have the cataract removed, you risk the cataract becoming too thick to remove.
So we're always kind of walking that tight line, and that's kind of getting, talking hand in hand between the surgeon and the patient and finding out when it's interfering with their life.
A talk that could have you seeing with diamond precision as you live out your golden years.
Now, cataracts typically develop in both eyes, but Dr. Yonker says sometimes there's only one eye affected.